Hello friends, welcome to Daily World Television. We are privileged to have today with us Dr. Sukhwinder Singh Saggu, who is an expert laparoscopic GI and bariatric surgeon. Dr. Sukhwinder is presently Director MIS and Bariatric Surgery, Apollo Spectra Hospital, New Delhi. He did his bachelor's from SMS College, Jaipur, master's from Amritsar Medical College. He is a fellow of American College of Surgeons and International College of Surgeons, USA. He was also fellow at Sir Gangaram Hospital and Indraprasth Apollo Hospital, New Delhi. Dr. Sukhwinder has also done minimal access surgery training at Singh, New Delhi. He is a regular guest speaker and expert panelist and on various national and international forums. Dr. Sukhwinder has around 20 years of surgical experience in handling complex human metabolism structure. He has done pioneering work on obesity. Doctor, it is a privilege to have you with us on Daily World Television. You are welcome.
Yeah, thank you so much, Manoj. Thank you very much for brief introduction. Thank you so much for your words of appreciation.
Your profile is so long that it will take around 1 hour if I go through the entire profile. So I've just taken the highlights out of it, and I hope it will suffice. Doctor, we'll start our discussions with few questions related to the current pandemic. So now we have around 59 lakh cases worldwide of corona, out of which 3.62 lakhs deaths are there, and 25.92 lakh have recovered also. So my first question to you is how to keep ourselves safe during this corona?
Yes, Manoj, this is the unprecedented crisis which we are going through, and all of us, we are under lockdown. We are sitting in the houses, and I think we should start our talk with the positive news that many patients, they are going to recover. They are already
That's a
recovering.
wonderful note to start with.
Yeah, and the recovery rate of India is pretty good. Maybe we can say highest in the world. It is around 40%. So
Okay.
we should not be worried. We should not be scared about the infection because this is an infectious disease, and they are going to have a lot of infection. But we should be worrying about the death rate and the recovery rate. If you have a recovery rate on the high side, if you have a death rate on the lower side, our death rate is also around 3 or 3.1%. That is also lowest in the world. So if these two parameters we can control, I think moreover we can control the disease. Right? Yes, this is the new enemy. This is an invisible enemy. We cannot see the enemy, and we don't know the strategies of the enemy. So that is why we should have to follow lot of preventive measures for that. So
Ji.
lot of people, they are waiting for the vaccine to be developed. If the vaccine would be developed, I think we will be safe of this COVID-19. But I think we should strengthen our immunity. That is very important. So vaccine is also a type of immunity. It is an acquired immunity. So some part of the virus is being injected into your body, and we are going to develop antibodies against that part of the virus or the whole virus. So that will take some time. So if we can develop our immunity, if I'll give you one example. So how does the defense of our country is being done? So there is a BSF around our country, that is 24-hour on deputation,
Right.
right? So first layer of the defenses are BSF.
Yes.
Then if something happens, then the army comes in place, number two. And if something deeper happens, then commandos, they are coming inside. So
Right.
if we can say that the BSF of our kingdom, so if I take our body as a kingdom, so BSF for our body is our innate immunity. So there is two type of immunity, that is the innate immunity and the adaptive immunity. So innate immunity is you have a natural barrier, that is the skin also, your mucous membrane also, the mucous membrane of your bladder and your urinary organs also. So that is, and some NK cells or some lymphocytes also. So these are the innate immunity. I know this is a non-specific immunity. So this is the first layer of defense. Second layer of defense is our other immunities. That may be adaptive immunity, but that is a natural immunity. Why we are saved of this virus, why the infection is not severe in India, because we are more prone to have lot of infectious disease. We had a lot of outbreaks of, we had a malaria also, we had a tuberculosis also. So because of all type of pandemic already happened in India, so we are more immune to these type of the infectious disease as compared to the other world, right?
Okay.
So already we have some sort of antibodies. So somebody say they're saying that we are including a BCG vaccine in our national immunization program. So that is also helpful for us because we already have vaccinated for the BCG and we have already some sort of antibodies in our bodies, so they can fight against the COVID-19.
So
So
this is a good hope we have against the virus.
yeah, yes. So that is why the infection is not severe in India because we have more population of young people. We don't have an older population much. It's the highest in Italy and second most in US. So our older population is less, and our older population they are living with the joint families at their places. They are living in the old age homes. They are primary care homes. So because our elders they are living with the younger population, so they also have immunity. So that is why the elder people of India are also not being having a severe complication of COVID-19. So
Okay.
lot of things are there which is going in favor of us. So my message would be we should be strengthening our immunity. That is very important in the crisis of this pandemic of COVID-19. How we can do that? Yeah.
Thus, talking about vaccines, I was reading yesterday that around 30 organizations in India are working on vaccine. And normally they say it takes around 10 years to develop a vaccine. But our target is to get it developed in 1 year. So how far this is true, doctor? How much time do we expect the vaccine will be out?
Yeah, I think more than 100 candidates are there for the vaccine to be developed in all of the India. So even from China, America, Italy, Europe, British, all everybody is doing to develop this vaccine. So there is a set criteria of to the vaccine to be developed. So there is number one, first stage is they are going to develop the part of the virus or they are going to manufacture the virus in the lab. So that has already been done at more of the places. So
Okay.
that development of the virus or manufacture of the part of the virus, it may be the spike of the virus, it may be some part of mRNA of the virus that has been already been done. Then the step is that they have to take a lot of approvals,
Mhm.
may from the national body, from international body. I think that has also been done now. Now
Okay.
the next step is they do some clinical trials in the animal forum. In the
Right.
animal trials are there, and then the fourth is the human trials are there. The fourth A is they are going to do the human trials within the country, and 4B is they are going to trials on the international human beings. So these five steps are there. So this is a lengthy process. It will take around I think 8 to 9 months. It will take because already 2 3 steps has already been done.
Okay.
Animal trials that can be skipped because of this pandemic, so they can directly go to the human virus. And the Britishers, I think, they have started the human trials also. And I think with the end of this year, they are going to develop the vaccines.
Okay. So coming back to the role of immunity, what suggestions do you give to the listeners or the viewers that how they can improve the immunity?
Yeah, if we talk about the immunity part, so there are a lot of factors which affect the immunity. So if we start with the age, if with the increasing age, the immunity is definitely will go down
Right.
because there is decreased T cell formation from the thymus. There is a decreased function of the bone marrow that will also cause us a decrease in the T cells, and obviously there is a less eating and the malnutrition and the malnutrition is there. So that is why the immunity goes down with the increasing age. Then your diet, how you're taking diet, because if we compare our immunity with the defense system of any kingdom, so if we have seen that defense army they need more, they are dependent on the kitchen.
Right.
So the diet has to be very good. If we give the nutritious diet to our army people, our defense people, then our warriors, then I think they can take care of our country in the better ways. Same at that level, our defense system inside the body, that is the immunity. If we are going to give them a good diet, then only your immunity can be on the higher side. So if we talk about the diet, we should take less of carbohydrate, more of protein, less of fats, and lot of supplements like zinc, selenium, iron, cobalt, folic acid, vitamin A, vitamin D, vitamin C, and vitamin E. So all these things they plays an important role in the boosting of your immunity. Then your environment. Environment is very important. You have to be very stress free if you want to increase your immunity. If there is any stress, the immunity definitely will go down. Then the external environment. we have seen in the COVID-19 area, environment is very good. Our air has become very, very pure. Gangas and Yamunas, they have become very clean. So this environment is also playing very good role increasing the immunity. If you have a less pollution, your immunity would be good. If you have a less traffic, your immunity would be good. If your family environment is also plays very role in your immunity, if your family relationship is very good, then you have a good immunity. If your professional relationship is good, so environment, whether it is a social environment, your family environment, your professional environment, or the environment of your society, so if you have a good relationship with your colleagues, with your boss at your professional side, if you have good relationship with your family members, there would be less stress and your immunity would be very good. Then definitely you need to do some stress busting activities also. That will also play a major role in the immunity. Then exercise. If you do some physical activities daily, that will take care of your stress and that will boost up your immunity. Then comes your sleep. The sleep has to be very good, whether it is a sleep pattern, whether it is a sleep duration, whether it is a sleep quality, whether it is a sleep discipline or sleep hygiene. So everything has to be very good. You should be very disciplined about. There should be a fixed time of going to the bed and rising out of the bed. So all these factors, if take care, then there are 5 points which can boost up your immunity. Number one, you have to stay active. Do some physical activities, stretch your muscles. That will boost up your immunity. Number two, if you're taking alcohols, avoid the alcohol, avoid smoking. Number three, have a very good sleep, have a good quality sleep. Number four, do some stress busting activities. It may be meditation or it may be yogas. You can do everything. At least you keep yourself stress free. And number five is take your supplements. That is very important. If you are a vegetarian, you need to take a lot of vitamins in the form of the supplements and have a good control of your disease, whether you are suffering from diabetes, hypertension, or kidney disease. If you are keeping control of your disease, your immunity would be on the higher side.
Right. Doctor, talking of supplements, we have so many supplements in the market and online also so many supplements are available. So what do you suggest? Which supplement, like is there any single supplement which one takes and he gets all the vitamins and minerals which normally a body cannot absorb from the food which one takes during this period? So do you suggest any like specific supplement or some
So
kind of a generic
very
supplement?
Yeah, very important is you should take a B complex vitamins. That is the
Okay.
B6, B1, B12. That
Right.
comes in one formulation. So any preparation you can take for the vitamins, that is the B complex, any type of B complex. And
Ji.
nowadays the B complex, they do have some zinc also, selenium also, cobalt also.
Vitamin
So
C
they
also
come,
we have
yeah,
with,
yeah, even vitamin C also.
yeah.
So if you can take in this period, I think separately, if you can take vitamin C, that is very important. 500 milligram in the morning and the evening. That is a chewable tablet. That is very
Okay.
good for the immunity. That is very good in this pandemic area. Then
Okay.
comes vitamin D. That is also that plays also very good role. So vitamin C is 60,000 units, international units you have to take. That is twice a week you can start with. Or if
Okay.
you can, you combine with the calcium, that is very good. Combination of calcium and the D you can take daily. And there
Mhm.
is a vitamin E also that you can take 500 milligram BD for some days. So I think these vitamins, if separately you can take, that is very good.
And then you named some other selenium and cobalt and other uh,
So
minerals.
these all are the minerals that are there when you take any type of the vitamins. So they comes in combination.
Okay.
So
Okay.
selenium is there, zinc is there, cobalt is there, folic acid is there. So all these minerals, micronutrients, they are also very important, plays a good role in the immunity, and they are already there with your vitamin formulations.
Okay. डॉक्टर साहब टॉकिंग अबाउट एक्सरसाइजेस आप खुद बॉडी बिल्डिंग करते थे आई हैव कम टू नो ड्यूरिंग योर कॉलेज डेज तो व्हाट डू यू
Yes.
सजेस्ट टू पीपल लाइक व्हाट काइंड ऑफ एक्सरसाइज इज वेरी गुड लाइक वेदर दे शुड डू योगा रनिंग और स्ट्रेंथ ट्रेनिंग जिमिंग क्या करना चाहिए which is one exercise which will help us increase our immunity or they should also do body building क्या मतलब कैसे करना चाहिए
Yeah. So first of all, I'll tell you how the exercise is going to help for our health maintenance, right? So basically, any type of exercise is a physical activity which improves your cardiovascular health.
okay
So any type of exercise, it lowers your blood pressure also. Definitely, they're going to help to control your body weight. And the patients, they it tell you, and it make you immune against lot of variety of the infections, and it contributes to the general body health, increases the immune system, it increases the circulation of the body, and by increasing the circulation of the body, so it plays a good role in the immunity. It make you active, it make you flexible, it make you aware of everything. So
Okay.
basically, three type of exercise are there. There is low to moderate intensity exercises. That is the walking. You can say jogging is there, right? Some sort of stationary biking is also there. Then there is a strengthening exercises, that the weight training exercises. And number three is the interval training. So
Okay.
if you go number one, number two, number three, so effectivity is increasing by this. But you have to see. So first of all, to start with any type of exercise, you need to understand the capability of your body. So
Right.
at least you should not be going beyond the capability, because exercise, it sometimes it becomes very critical if there is any injury. So you should know at least the capability of your body. Whatever your body can tolerate, you should do that. You should not be going beyond that, because any type of injury is going to give you sedentary lifestyle again for 1 month or 2 months, and that sedentary lifestyle is going to add your weight that will not help you in the weight loss. So
Okay.
first you should understand your capability, and according to the capability, you can start with low to moderate intensity exercises. So low to moderate, like you can start with walking, you can do your jogging, you can do some stationary biking also. But some sort of, I mean, after sometimes we have seen that low to moderate intensity exercises, they will not help you to drive your weight loss. Maybe it will be help you in maintaining your weight.
Correct.
So what we can do, we can supplement this low to moderate intensity exercises with number two, that is the weight training exercises. So we can do 3 days a week. We can start with the low to moderate exercises, and 3 days a week or 3 4 days a week, we can start with your weight training or strengthening exercises. So
Okay.
in the weight training exercises, we have seen a lot of calisthenics also. In that, squats are there. I mean, lot of push-ups are there. You can do jumping jacks also there. So you can do all these type of the things. Plus, you can do the free weights also. You can do machines also. So, but the critical is you should at least know the real technique of doing the free weight exercises or machine exercises, because the critical is if you are doing not with a good technique, you can have again injury. So
Injuries.
I would suggest that you should do these type of exercises initially under the guidance of a good trainer. And once you trained properly, then you can do yourself. You can do free weights also, dumbbells also, kettlebells also, and the free machines also. Then all type of push-ups. Push-ups are very good. You can do the push-ups, like you can do the lunges also. So these type of the exercise, they are less critical, they are less prone to your injury. And
Okay.
number three is then interval training. Interval training is very effective. That is a very short duration but high intensity exercises. Like you are running 100 miles within few minutes. So that is the interval training. You can do some heavy intensity exercises. So that is the interval training. So interval training you can do only when you are very much trained in these type of the exercises. So basically, frequency, intensity, and duration of any type of exercise is very important. Initially, there may be high frequency, there may be low intensity and long duration, but later on, you can decrease the duration, you can increase the intensity. So that is why instead of doing a 10,000 steps a day or running 10K miles is not that important if you run
Right.
only for 2Ks with the less duration of time, so that your body is less prone to have any type of accident injuries. You are more less resistant to any type of the injury. So that is why the increasing intensity and decreasing duration in the long term would be very good.
Right. So this is very good. That should be done under guidance. Whatever exercise we are
Yeah.
doing, it should be done under some trainer. Also, coming to metabolism, is COVID linked to some kind of obesity also?
Yeah, nowadays there are a lot of reports that they have seen. Even the CDC report from US, they says that around 50% patients of age 40 to 60 admitted in the ICU with a severe complication due to COVID, they are obese.
Oh, that's a great number.
For, yeah, 40% of more than 60 year of the age, they are obese. 60% of less than 40 year of the age, they are obese. So obesity is causing severe complications. So obesity is the single most risk factor developing the high severe complication because of the COVID-19. So we have seen that death rate is more in elder people, but now it has been increasing in the younger people, but only obese younger people, not in
Okay.
the non-obese. So if the death is there in the younger people due to COVID-19, that is basically because of the obesity. So I think you must have seen the article by the Prime Minister of Britain also. Once he was recovered from the COVID-19, and he said now he is going to make the awareness for the obesity because he
Yeah.
understood. Yeah, he
They want to go on
understood
a campaign
the
now.
yeah now he is going to start a campaign against the obesity because obesity
Yes.
is the single most risk factor for the COVID-19. We cannot say that COVID-19 any type of infectious disease, and this pandemic has come now. Obesity pandemic is there since years, since long. Obesity and the diabetic pandemic is there. We are fighting against both the things.
So how does one differentiate between being overweight and being obese?
Manochaji, there are a lot of criteria are there. There are the set parameters by which we can see whether it is a overweight or it is obese patient. So one criteria is a BMI, that is a body mass index. So
Okay.
normal body mass index is around 18 to 24.9, and if it is 25 to 29.9, there is it is comes in under overweight category, and more than 30 comes in category of obesity. 30 to 35 is the grade 1 obesity, and 35 to 40 is the grade 2, and more than 40 is the grade 3, that is a morbid obesity. This is a classification given by the WHO. But we Indians, or we can say the Asians, we are more prone to have comorbid condition because of the obesity at less BMI.
Okay.
So the Indian criteria has changed. So instead of starting 25 as a overweight by the WHO, our criteria, Indian criteria, is from 23.5 to 27.5 is the overweight.
That
So
brings
our
many people into obese category then.
yeah, so basically 2.5 units of BMI is lower in case of the Indian people. So more than when there is obesity start from 30 BMI by the WHO, Indians narrow it starts from 27.5. So 27.5 to 32.5 is the grade 1, 32.5 to 37 is grade 2, and more than 37.5 is the grade 4. So morbid obesity, when it starts from 40 by the WHO or by the Western countries, in India it starts from 37.5.
Okay. And I would like to tell viewers here that BMI can be calculated by dividing the weight in kg by square of one's height in meters. I think that's the formula for
It,
calculating that.
yeah, it is a relation of your weight with your height.
Weight with your height in meters.
Yeah, yeah.
Okay, doctor. So, doctor, what do you suggest that how can, suppose somebody becomes obese, so how can he get rid of obesity?
So, Monucha I mean, there is a no single size which fits to all. We know
Mhm.
that.
That's true.
And yeah, according to the BMIs, we are going to treat the obesity. If suppose you are in the overweight category, he or she may be in overweight category, then definitely first line is we can modify the lifestyle also, we can modify the diet also, we can start some activities, some physical activities. So that can help for the reduction of the weight. If once it has come into the category number 2, obesity, then exercise and the dieting will not help for reduction of the weight. Then we do the surgery, that is the bariatric surgery. So with the help of the bariatric surgery and then supplemented by some sort of dieting and exercise, I think we can help those type of the patients for the weight reduction.
Doctor, can you tell us something more about bariatric surgery, because this is a very popular surgery now and a lot of people are going in for this, and how it is different from liposuction?
Bariatric surgery is a basically a branch of it's a surgical branch of medicine which take care of obesity treatment and take care of the obesity related comorbid condition like diabetes, hypertension, sleep apnea, infertility, and so many other conditions. So basically, when there is an obesity enters into the grade 3, it's a morbid obesity. Then I don't think there is any recipe for that we can reduce the weight. The only solution is the bariatric surgery. So bariatric surgery is we are doing this bariatric surgery since so many years, maybe 3 decades. We are doing this surgery. Earlier, this surgery was done by the open method, and nowadays this surgery is being done by the laparoscopic method. So
Mhm.
laparoscopic method is a method when we are not going to cut all over your abdomen. We are just giving you 3 or 4 small incisions at various places on your abdomen, and through those 4 holes, we are going to do the complete surgeries.
Okay. And this taking out fats, or is it like reducing the size of the stomach? Maybe part of the stomach is taken out.
Yeah, when we talk about the liposuction, in liposuction, we are going to do the suction of the fat from your abdomen. And this
Okay.
liposuction can be done on few parts of your body. Maybe your buttocks, abdomen, some part of abdomen, some chest and breast part. But the bariatric surgery is a surgery which is being done on your stomach, that is the digestive system. And
Okay.
this is surgery which is being done at one time, and slowly patient is going to lose weight proportionately from every part of the body.
Okay.
There is a proportionate reduction of the weight from each and every part of the body. So this is the beauty of this bariatric surgery, and it's completely different from the liposuction. So,
Okay.
I mean, earlier it was known that the pancreas is a major organ of the body which takes care of your weight and your diabetes, but now it is your digestive system and your brain. So, the brain and the digestive system, that is GI tract, they work together to
Right.
make a physiology, which physiology makes changes in your weight and causes diabetes in the body.
So it is not only the pancreas now, which
Yeah, it
will.
is not only the pancreas now.
Okay. Doctor, sir, what is the typical cost of a bariatric surgery if one undergoes a bariatric? How much money does he have to shell out?
Bariatric surgery in India, we can say it starts from 2.5 lakhs to maybe 4.5 lakhs, depending on the type of the procedure, which type of the procedure is being done. So, a
Okay.
lot of procedures are there. The most common is the sleeve gastrectomy, where we are going to remove the part of the stomach and making the stomach a tube-like structure, like a sleeve of your shirt. So that is why it is known as a sleeve gastrectomy. Another is gastric bypass. There are many types of the gastric passes are being done. So the recent we are doing the mini gastric bypass, where we make a tube of the stomach and then we bypass some part of the intestine, and we are directly going to join this pouch of the stomach to the jejunum, that is the second part of your small intestine. So around, you can say, 150 to 200 centimeter intestine is being bypassed in this procedure. Then there is a Roux-en-Y gastric bypass. That is also type of bypass, but there is some difference between mini gastric bypass and Roux-en-Y gastric bypass. In Roux-en-Y gastric bypass, there is stomach is very small, and the chances of malabsorption is less than the mini gastric bypass. Then other things are also there. BPD is there, that is not being done in our country, but mainly in the Western countries, because the protein consumption is very less in our country. Then
Okay.
in past we used to do some gastric balloons also. Now we started doing some endoscopic bariatric surgeries also. So there are n number of surgeries, and according to the procedure and according to the consumable which we use in the surgeries, so there is a cost varying with the procedure.
And the type of surgery one needs depends on his level of obesity and his level of being
Yeah.
overweight. I think that's the
Yes,
thing.
there are many factors, Manocha ji, on that. The age of the patient is also very important. Whether the
Okay.
patient is in fertile category or non-fertile category, whether the
Mhm.
patient is vegetarian, non-vegetarian,
Mhm.
severity of the diabetes also, whether the patient is having diabetes since few years or since last 15 or 20 years, the number of the medication for the diabetes he is taking, whether it's a five medicine, six medicine, and the dose of the insulin also. So all these criteria are there. So on based on all these criteria, we decide what type of procedure patient needs, and accordingly we titrate the procedure according to the patient, according to the requirement of the patient.
Okay. Doctor, sir, I had a question in mind that since these days work from home is very common, so do doctors also work from home like telemedicine and robotic surgeries? Are they also common in like in
Yeah,
our country?
yeah, because initially we got a guideline from a government of India,
And
the government of health ministry. So even we were also doing some OPDs. Now we have started. Even we can say this is a result. We are talking. We are having a virtual meeting. So same type of the
yeah.
virtual meeting we are also having with our patients. So now what
Okay.
we have started, the first consultation of the patient we are doing virtually through
Achha.
the telemedicine. So a lot of benefits are there. There are less chances of any contact with the patient, so less chances of the infection because of the patient to the surgeon and from the surgeon to the patients also, and
True.
because of the hospital environment also. So
Mhm.
even the surgeon is safe and the patient is safe, and it save the cost of the patient also. It save the time of the patient also in a very busy, the lot of traffic in Delhi. You can say in the all metro cities, so
Ji.
you can save the time also. So I think this is the new invention which we have done. We started telemedicine right now. I mean, in this pandemic only, and this telemedicine is, I think, after the pandemic will over, and I think this will continue because this
This
is
will
a
come.
very good platform
Mhm.
to do some sort of meetings also, consultation also, and once you saw the patient, you have taken the complete history of the patient, and you come to know that the patient need I need to see the patient in person. So then I think we can call the patient in the office. Then for the second consultation, we are calling the patient to our office in person, and we are doing the physical examination and all the investigation, whatever is needed for the patient. So I think if I do this virtual consultation with 100 patients, and out of 20 or 30 patients, they need to come for the second consultation in the office. So around 70 patients, they can be satisfied with the telemedicine only. So those
So
second
there's a
during the
considerable,
second,
so there's a
yeah,
considerable risk reduction now
yeah, a lot of
with these
risk reduction
patients.
is there through this telemedicine.
Doctor, we have traveled around the world, being a doctor and like attending many workshops and conferences and seminars and doing surgeries around the world. And you are also in panel of many South African countries. So how do you find the medical condition of our country in a scale of 1 to 10? Like how do you rate it as compared to other countries?
So if I want to rate it on the basis of the quality of the medical services which we are providing, I think we are number 8 or number 9.
Okay.
Right? If I talk on the basis of the cost, I think we are at number 3 or 4, because at low cost, which the quality services which we can provide, I don't think any part of the world that can provide.
And there is also no concept of medical insurance, like very few people going for medical insurance in our country. So in the absence of medical insurance, how poor patients can avail all these modern medical facilities in our country?
I think a lot of things
That's
has
a very
been
big
done by
concern.
government of lot of things has been done by the government of India also. They have started the insurance also, Pradhan Mantri Bima Yojana, and a lot of things has been done by the government of Delhi also. So I think they are through these type of the insurances which has not been there with the poor patients. Now they are being there through, we can say, the government, and through all those type of the insurance they can avail all the modern facilities, all the modern hospital, modern medical services. As other people, they are availing all these things. So
Okay.
slowly and slowly, the insurance category is also increasing in our country. And now, I started my practice 20 years back, and there
Mm.
were hardly, you can say, uh, out of 20 patients they were having, or 15 patients they were having the insurance. And now I think each and every patient which they are coming to me, except bariatric surgery, because bariatric has not been covered in insurance, but all other patients, almost 60 to 70% patients, they are having the insurance. And definitely the insurance part of the people, they have increased in our country.
Slowly, people are becoming more conscious now.
Yeah, yeah.
Doctor, can you tell us something about Guru Nanak Cancer Care Trust? You are part of management trustee of this trust. So you also put in some time to that, or it's related to some
Yeah,
cancer.
Manotaji. So that is, I mean, we started in 2012.
Okay.
It's been 8 years now, and luckily we were traveling to Dehradun at that time. And on the way, we thought that we should have at least one platform for the people, because what we saw, there were a lot of NGOs. They were working for the diagnosis of the breast cancer, right?
Right.
And they were giving mammography reports to the patients, and they were not giving solution to them. So a
Mm.
lot of patients, they were coming because you got the mammography done, and in the mammography, if you are confused, and
Mm.
that make you more scary. The people were
Right.
coming with the reports of mammography, and there was no solution. So we
Okay.
thought, my wife is a breast cancer surgeon, and
Okay.
Harish Ahuja is there of Shai Export, if you know,
Mm.
and few of other colleagues from here from Delhi. So we
Mm.
thought that can we give some sort of solution with the treatment. If we can do, at least we can help them, we can guide them to take a right treatment through this trust. So then we made this trust, and being a managing trustee, and we luckily we could help a lot of people through Pradhan Mantri Yojana also, because Pradhan Mantri Yojana also gives some funds for the cancer treatment in Apollo, in Indraprastha Apollo Hospital. So we did our first camp in Dehradun, in Dun school,
Yeah.
and then we did in some parts of Delhi also. And yes, it's going on. Whatever we
That's a
can help the
wonderful.
people, because at
That's a
least we
wonderful
should,
initiative, Doctor. You.
yeah, we should give something to society, which we have taken a lot of things from the society.
That's a noble thought.
Yeah.
Doctor, thank you for giving us your precious time. It was indeed a pleasure talking to you, and with much of information, I think the viewers will get a lot of information on COVID, on obesity, on overweight, and all. And anything you would like to say, like any tip you would like to give to our viewers as a concluding remark?
Yeah, my message would be prevention is always better than the cure. So
Wonderful.
why would be looking at the bariatric surgery? Why would be looking the BMI more than 30? So if
Right.
we can check our obesity, we can prevent our obesity, and that can be possible. You know, all the efforts for the prevention of obesity, it should be initiated in the early development of the obesity. So now we have seen the reason for the obesity, it starts before your birth. So when the parents, they are going to plan for the conception of the pregnancy, at least they should not have a obesity. Both of them, they will be obese. Then definitely they are going to be born with the obese child. So basically, the childhood obesity, neonatal infant obesity has to be prevented. If the in the pregnancy you should not be smoking, like all this, if you should have a healthy diet during the pregnancy. So if you can take care of your health during the pregnancy, I think you can prevent a lot of obesity for this nation. Even after the pregnancy, also we should be there should be at the early starting of the breastfeeding for early 6 months. For initial 6 months, there should be completely breastfeeding, no other supplemental diet. After 6 months, if we start the diet, that should be supplemented with a low fat diet. And accordingly, if we can take care of the diet, I think we can prevent the obesity. And during the childhood, I think these are the parents who should be make aware of the obesity, so that they can prevent the obesity in the childhood. So if we can prevent the childhood obesity, I think we can easily prevent the adulthood obesity.
So, with this wonderful message that prevention is better than cure, we thank you a lot, Dr. Sukhwinder Singh Sabu, and we look forward to talking to you sometime again. Thanks.
Thank you.
Thanks again,
Thank you
Doctor.
so much, Munataji. Thank you so much.
Okay, viewers, stay safe and have a wonderful day. Thank you.